Hello, everyone. A very good evening to all of you. Myself, Dr. Jamuna, heading Clinical Excellence and Research Team at QurHealth. I welcome you all for today's webinar session, which is on topic Surgeon's View on Post-Operative Outcome with Post-Operative Care. Our guest speaker for today is Dr. Balaganeshvedati, a very renowned surgeon in Hyderabad. For those who do not know about our company, I would just like to give a brief introduction about our company. Our company, QurHealth, is a conversational AI company delivering personalized care at scale. Our vision is to save lives super proactively. Our user-friendly app, QurBook, has more than 2,500 care plans and diet plans under 30 different health categories. These plans will help to improve patients' health condition by monitoring their vitals, symptoms, and everyday lifestyle management activities, which are specific to their disease condition via AI Sheila. Our Care Concierge program consists of expert team with specialist doctors, dietitians, physiotherapists, counselors, and highly skilled nurses who act as care coordinators. These nurses will be remotely monitoring your health condition through regular follow-up calls, and they will make sure that you adhere to the activities of your care plan, take medication on time, and eat healthy food that is being suggested in your diet plan. So before we start today's webinar, I would like to introduce you all to our guest speaker for today. Dr. Balaganeshvedati is the founder and CEO of Surgeon for You organization. He's a consultant general in laparoscopy, laser, robotic, minimal invasive surgeries, colorectal specialist, proctology, and podiatric specialist, and also a highly trained and skilled surgical oncologist and expert in family health counselor. He did his MBBS from Dr. D.Y. Patil Deemed University and observership at AIIMS Delhi. He completed residentship in the Department of Surgical Oncologist at KIMS Hospital, Hyderabad. He pursued his MS from Chalmida Anandrao Institute of Medical Sciences, Karimnagar, Telangana. He did his fellowship course in FMAS, DMAS, FIRCS, and at World Laparoscopy Hospitals, Gurgaon, Delhi. Dr. Balaganesh is a distinguished personality who contributed his professional mastery and ardent kindness to win the heart of the patients. He is a consultant surgeon at KIMS Secunderabad. He is a visiting consultant at Pristine Care. He's also a visiting consultant at Vitality Hospital and a consultant general at Glamio Health. As an orator, he has established a solid ground for motivating others in several medical and non-medical conferences. He is a member of Association of Surgeons of India and member of Indian Podiatric Association. We are very honored to have you with us today as our speaker, Dr. Balaganesh.
Thank you. Yeah.
I would like to inform all the viewers that you can type your questions in the comment section, and these questions will be answered at the end of the webinar during the Q&A session, which will be conducted by Dr. Isha. So let's begin our webinar session. Before I start, I would like to first mention what is the importance of post-operative care. So post-operative care is crucial for patients after surgery in regaining their strength and health and enabling them to return to everyday life. It also plays an important role in pain management. Recovery after an invasive surgery is vital in making the treatment successful. And this phase can be slow, stressful, and also sometimes very worrisome. Previous research has showed that 7 to 15% of patients undergoing major surgery will experience post-operative complications. And it is also well known that every year, 4.2 million people around the world die within 30 days of surgery, and post-operative deaths account for almost 7.7% of all deaths. Hence, post-operative care is a very crucial aspect in healthcare. It is very important to follow up with the discharged patients in order to prevent the complications such as infections, promote healing of the surgical incision, and return to a state of perfect health. This webinar provides a detailed insight into the post-operative care guidelines, various post-operative complications, and their implications on treatment outcomes. So, Dr. Balaganesh, please let our audience know about your well-known and renowned health organization, Surgeon for You, and also elaborate on the importance of health in making difference in patients' lifestyle.
Thank you. Thank you so much for your wonderful introduction about me and my organization. And I'm very honored to talk to you all today on this live platform regarding my organization, about my work and my post-operative care with QurHealth and how things have been changed. First of all, hi to all my beloved audience. Today, I would like to briefly explain you about my work, what I've been doing right now. I'm doing as a exclusive surgical work in the field of surgeries, that too from all the variants like laparoscopy, lasers, colorectal, proctology, podiatrics, and minimal invasive, all the methods. And also we've been performing bariatric procedures for the weight loss and so many of the procedures. And so Surgeon for You is exclusively covering from head to toe from all the surgical departments, not only for the general laparoscopy, but it is also involving all the super specialty branches. Our Surgeon for You is just made to be a one-stop solution for all the surgical needs. So in that way, I would like to share few of my personal experiences and personal what I personally think about post-operative care, how much it is important, and all the things. First of all, for any of the procedures, post-operative care is the most important role. What I want to say is post-operative care is a game changer in a patient outcomes. A surgery can be done by so many of surgeons, and everything can be managed. But the post-operative care and post-operative outcomes are the most important in every patient, like how the patient are being well-being, how a patient are mobilizing immediately after surgery, how patients are taking a diet of the surgery, how patients are taking medications of the surgery, how patients are responding after the surgeries. If the small problems, comorbidities, or whatever, if we say you need to take care of yourself for 7 to 10 days after the surgery, patient should be very much keen and particular about his symptoms and everything. He should also be very much conscious about his generalized condition, the way how much he is taking the food inside, whether he is able to pass, and whether he should not be stagnant. What I have observed in my so many of patients are who are having a strong willpower, who are moving out of the bed immediately one day after the surgery, who are taking proper food and diet and medications, and also who are just keeping the note on what they are doing in the life in their routine way. These are all making a lot of differences in outcomes of the patients. And I would like to point out few among that is a few days back, a few months ago, I've started an organization, and I've been coordinated with, I've been associated with QurHealth, and these people are really taking a wonderful post-operative care about from my patients. They maintain the records properly. They talk to us about the diet of the patient. They give the complete information to us in instant way, in an immediate way. They doesn't delay on any of the prospective. This scenario, this type of prospective, this type of intervention from two different organizations, from the Surgeon for You and QurHealth, are bringing a wonderful outcomes in the patient. See, in the busy life of a surgeon, we can't concentrate on each and every patient's outcomes about their post-operative, how they are managing and everything. But we will be feeling like, oh my God, we have been operated. How is he managing himself? How is this taking care? In that way, QurHealth has come forward to take diet care and physiotherapy care, and also patient counseling perspective, and also patient coordinators are an important role in our in this platform, where each and everything has been mutually communicated from the point of for the surgeon. They give the information to us, and also to the patient, whoever we are being collated with the QurHealth. So this is the scenario which has made me to come forward, come to you all and explain my feeling and my my way of thinking towards the QurHealth. And there are so many of things which we will be individually talking about the things which we need to be discussed. So Jamuna ji,
thank you very much, doctor. We are happy that we are able to serve your patients at our best. So so coming to the webinar topic, doctor, so as we discussed earlier, post-operative care is very much important, and post-operative guidelines mention that patients need to be taken care after surgery, especially the first 50 to 20 days. So which are the most important guidelines that they need to follow, doctor?
First of all, the post-operative care, first of the things are whether patient should address, we should be in a conscious way. Whenever the patient has taken the admission inside the hospital, on the first 3 days, if there is any signs of fever, any signs of redness, any signs of these things, they should not neglect. Even after the patient gets discharged, or else post-operative, after the operation, in the 72 hours, if a patient find any discomfort at the surgical site, wherever we put the surgeries, if there is any redness, is there any discharge, is there any adhesions and everything, it should not be delayed. It should not be kept inside him. They need to come forward. They need to explain us about what exactly the problem is going on. If the infection starts after the 72 hours of the 72 hours after the admission, then it is considered hospital-acquired infections that are all very severe, and it should not at all be neglected in any of the way. And also the infections and all the things are a part of it. But priorly, if a patient have a fever, if they have which are troubling them, they need to, as early as possible, they need to talk to surgeons, and they should detailedly we need to take care of that patients, and definitely it should be a first importance for a patient to be taken care.
So post-operative patients usually are being advised to get out of their bed and start moving as early as possible. And doctor, as you already mentioned, mobilization is very important. If this is not followed, what are the kind of serious consequences the patients will be facing?
Yeah, no doctor in the world will say the patient to take 7 days of complete bed rest. Every doctor, every surgeon will expect his patient to get out of his bed as early as possible and mobilize. And mobilization will always make patient recovery time faster. It can make better. It can really push the patient to recover in as early as in the less time as possible. If the patient is stagnant, if he is not at all moving, his digestive system will be will be reduced. He will be in a malaise state. He will feel weak. He will have all the signs and symptoms which are not at all related to it. And if a patient makes himself an active, if he put himself as an active, his recovery time will be really cut down to half of it. And for every of the surgeries, except few hip surgeries and something, the orthopedicians gives the instructions. Rather, all the surgeries, as early as possible, if patient is back to the conscious, then we should make him, when we need to make him to get mobilized and come back to the normal style. Okay. Yeah.
And many people have different kind of complications post-surgery. Some are like transient ones and some are like serious ones. So which are the most common post-operative complications, doctor? And how long after surgery these complications arise?
Yeah, there are so many small complications and big complications. The only big complication everyone worried about is called sepsis. Sepsis is nothing but surgical site infections. We call it as surgical site infections, and we call it as and other like patient will develop fever and all the things. These are all the symptoms of sepsis. These are the most complicated. I will talk about the least complication things later, but this surgical site infections are one of the which will not even make a surgeon to sleep also, because that are the headache even for the surgeons, even for the patients. It happens due to so many of reasons. One time, if the hospital is not properly sanitized, if we are not properly washing our hands before the surgery, if we are not maintaining the sterilization codes properly, and if a patient is already developed the infection inside him and we are operating on that particular patient, we need to be given with proper post-operative antibiotics, prophylactic antibiotics for that particular problem. These are the sepsis. I don't want to go deep into the sepsis to make everyone fear about it. The sepsis is nothing but the surgical site infections, which will be slowly, the infection will go into the bloodstream. That will create inflammation all over the body, and it will start affecting the major organs and the surrounding tissues and the major organs, and it may future lead to multi-organs failures. So this starts in a small problem. This starts as a small symptom which will be aggregated, and later this will definitely increase. So we need to be in a perfect place, perfect hands, and perfect atmosphere of surgery, and sterilizations and everything are very important, and everyone should be aware that they should take the admissions which have a NCBI guidelines and DZB, whereas these are all the basic protocols should be maintained from all the things. These are the major complications. The minor complications are like, minor complications, small complications that like we need to if a patient of this surgery, if they are not taking care of the wound in the personal at the time, we'll say change your dressing, come to the proper visit, and if patients will go on delaying in it, we say to come after 7 to 10 days. In that scenario also, they will not come forward, and they will be delaying it. In that whatever the small it's not related to the surgical infections. Anything beyond that are all the minor problems which we can be handling, and appetite and diet, whatever the things are, should be properly managed inside this. Yeah.
And also studies have shown that the surgical site infections are most common complications following major surgeries. And this is affecting more than 25 and 40% of patients. So like you mentioned, the surgical site infections are caused due to unhygienic conditions and no proper post-operative care. So if at all a patient comes up with these kind of infections, inflammations, and symptoms, which you can clearly make out, like this is because of this post-surgery not proper care given. So what do you recommend these patients to do? Like should they be calling directly to the hospital? Should they be visiting?
Yeah. If these symptoms are being seen in any of the patient, immediately we call them to the surgery. We call them to the hospital. We will examine it whether the infection, the site of the surgery is absolutely fine or not. If there is any redness, any tenderness, any chances of additions is gapping, or is there any fever, is there any discharge, then we need to reopen it. We need to properly give the proper antibiotics to him, and and we need to do the intervention as early as possible. We need to open it. We need to clean once again. We need to redo the some minor procedure into it, and we need to keep the wound open, and we need to regularly dress that, and the patients will be pumped with triple antibiotics. That's not two. It should cover gram positive, gram negative. These are all the terminologies which we use for the bacterial infections, and some are antibiotic resistant modes of. There are so many such type of organizations, such type of bacteria which will be causing problem to us. First of all, we will be taking the swab from the surgical site. We will be sending that to the culture. From that culture, we will come to know what type of organism is properly affecting our body or else immune system. According to that, we will be giving the medications to the patients, and regular dressings and all follow up with the proper nourishment, food, and all the things will make difference in the patients. But it is very important that the patient should address, and they should come to us as early as possible if they come across some such type of situations.
Yeah. Yes, doctor. And also, doctor, whenever the patient is getting discharged, the doctor would have prescribed a set of medications, like you mentioned, mainly the antibiotics and all that. So, especially in our country, India, we know that most of the patients try to skip the medications. Either they cut short the number of days, or they leave some of the medications and just focus on 1 or 2 medications. So what would be the outcomes of these kind of negligence from the patients?
Definitely, this is the best question which you asked, and so many of the patients will, even though we say them to take 7 to 10 days of medications according to their outcomes, patients will come for the 5th day. They say, "Sir, I'm feeling this. I don't want to take it. I don't want to, do this, that." But it's not at all suggestible to them. Definitely, according to the body weight, according to their condition, according to the nature of the disease, we will be giving the medications. It is not only limited for 7 to 10 days, it may also extend in few of the patients. And we as a surgeons will take utmost care in giving the medications also. We don't want to dump our patients with unwanted medications, but the medications which we are prescribing in the discharge summaries are definitely will be for the use of the patients only, and there is no shortcuts for skipping such type of it. And if they do such type of things, some in the after 7 days, after a few days, the infection may redevelop, and again the problem will tap their dose, and once again they need to go through all the things. Rather doing this big round and round, it is better whatever the medications has been suggested in the time manner. If they can take it, that will be great. And always make sure the medication part is okay, and also the follow-up also is very much important. Patient should also not ignore that, everything is fine. No. This type of negligences are not at all accepted in practices. Thank you.
Yes.
Yeah.
So post-operative care is very much needed, especially the medication should be taken on time, as well as on the till the duration what the doctor has prescribed.
That's true.
Yeah. And doctor, many people experience extreme stress after surgery. And research has shown that mental health issue can have negative effect on a patient's recovery post-surgery.
That's true.
So what are your suggestions for maintaining good mental health post-surgery?
First of all, one thing which is there, I have saw in so many of patients is they created they created some visualization that surgery once after. If you randomly ask a person what is your opinion on a surgery, everyone say, wow, this week it's going to make this, that, and a few of them say after going for the surgery we'll definitely put off, our energy will be gone, we can't eat proper food, we can't do this. This is all not said by a doctor. This is all which are created by themselves, and they believe that is right. But in due course of the modernized medicine has taken or the present scenario, here there is no complications. Patient's work is to come and to know their problem, and then they will be then we will be explaining about the nature of surgery, what they are going through, and we will also give them in which way we are going to give them the comforts. Like, in some of the surgery, patient will be sleeping. The only tension situation is only for the doctor, not for the patients. He can definitely, once after he wakes up from his anesthesia, he will be back normal soon. And then patient, we should feel that, he should, one thing I want to say, if patient have a trust on the doctor and a doctor has a trust on the patient, definitely there is going to be a very proper outcomes for the patients, what they were feeling. If a patient keeps a lot of unwanted things in their brain and unwanted, nothing is going to happen for sure after the surgeries, because we don't want to operate on a healthy person and make them to sick. No person. We are doing a problem on the problematic patient and want to bring a problematic patient out of that problem into the normal style. This is the reciprocate way, in the reverse way. And after that, mindset of the patient should adjust in such a way. He should think, I have some small issue. It is going to be corrected by the surgeon. Immediately, he will give the necessary instructions and he will give the perspective of post-operative carers. And definitely we are going to be active. And whatever that the doctor will say is, if that will be followed by the patient, definitely his outcomes will be extraordinary. One thing I want to say, please take out a false, false type of imaginations from your brain, and your outcomes and everything will be absolutely in a line way. So everything will be fine in a future perspective. Yeah.
So for such kind of patients who always have that fear of surgery, do you recommend counseling, psychotherapy counseling?
100.
Be important?
Yeah. Obviously, the counselings are very much important. If the patient is very feared, and if they are not ready, so many of patients are not able to decide whether they want to go for the surgery because of their fearness. Actually, they will be having a problem, but they will be feeling, what will happen if I go? And in that way, the counselings and all things are very much important. In that, we need to be taken. We need to be very much conscious on. If that's so, the patient should definitely go for a proper counselling, and the counsellors will definitely guide them in a proper way. In that, they can definitely go into the better outcomes, and they can go forward and they can get a good prospect of surgery to them.
Yes, doctor.
Yeah.
And in recent days, lipomas are the most common benign mesenchymal tumors worldwide, and more than incidence of 10% is observed worldwide. So at what size should a lipoma be removed, and what are your suggestions for these kind of lipoma surgeries?
Yeah, lipomas, one thing I want to say, lipomas are not a very benign type of swellings, and this is all accumulation of fat on the body, and patient will have multiple lipomas over the body, and looking into it, patient will come into it, what has happened to me, what is going to be my future about these things and everything. And for these lipomas, the most advanced treatments have come with no scars also. By giving a pinhole, we are able to remove big lipomas. The lipoma sizes may start from 0.5 centimeter and it can go up to 30 centimeters and beyond also. So the lipomas is only a problem whereas accumulation of fat will happen. Slowly the size of the collection of areolar tissue will be going on, and it will give the bad cosmetic scar. In that way, if the patients comes to us, we will be putting if they come in the small swelling, we will give a pinhole over the swellings, and we'll try to remove a complete capsule out of its body. And later, these lipomas are also associated with the food, and also it is also associated into the genetical perspective. Once the genetics we can't change in between our lives, but we can definitely with change in lifestyle modifications, diet modifications and all. In this way, the patients, if they turn themselves into this, then they will feel good about it.
And also in recent days, these bariatric surgeries are considered to be more effective therapies for obesity, doctor. I think you will also be coming across with a lot of patients for this kind of surgery.
That's true. Yeah, nowadays the weight gain and obesity is the biggest problem which as a surgeons we will be coming across. Obesity, there are a lot of advanced surgical case and advanced procedures which are there, like the sleeve gastrectomy, binding, and also, ligating of sleeve gastrectomy is taking out small portion of it, placing barium ball implantations into the stomach. There are multiple ways to handle it. But one among the important thing which everyone should make a note is that, once the surgery part, okay, but the post-operative part, and also one important thing is diet and nutrition. If a patient is not able to reduce even after the diet and nutrition take up, then then we will be suggesting it. If so many of patients, for example, they walk into the hospital, they just directly say, sir, we want to go for the surgery of, we have developed some fat over here, we have here, and we need this, and please do liposuction, please do gastrectomy, please do that. But definitely in that patients, we are not directly going to operate. We will be guiding them to our nutritionists and dietitians. Let them try to talk to the patients and enlighten them that, if we eat less, work more, automatically the body is such so the fat will be reduced and he will slowly cut down his weight. But so many of patients nowadays have no, they don't have a long type of caring themselves. They want shortcuts all the time. And patients are all very happy on shortcuts. Definitely that is an advantage for the doctors and even for the organizations. But as my sincere thing, which I want to share to all, if you are not moderately obese, if you have a mild to, if you are not severely obese, you are mild to moderate, if your BMI is slightly above the normal or comparatively little bit more, first of all, try by proper nutrition and diet and eat less, work more. Definitely this is going to be changed. Later scenarios, then we can plan about if your results are not coming out of it, then definitely we will do the procedures. After that, our cure team will take care of the post-operative, how the nourishment and everything. And one example I want to give, after the sleeve gastrectomy, the intake of food will be very much reduced. They can't take more amount of food. They will be taking 2 to 3 spoons of after that. They will feel like bloating. All the bariatric surgeries which we have been talking have such type of complications. It is not easy just like to go, and because they'll cut down the intake of the food and also nutrition and everything. Their surgery is an important thing, but your part of post-operative care is very, 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 very important after the bariatric surgeries also. Even lipomas or liposuction is also one such. After removing the fat from the subcutaneous thing, if you are not properly maintaining, definitely once again it is going to be recurred. And once again he will put on the weight if they are not properly managed.
Post-bariatric surgeries, though these patients come for weight loss, there are chances that these patients will put on the weight even after the surgery. Will they
few
back to their
among
normal weight? Yeah.
No. A few among. If I'm talking about the liposuction, liposuction is removing the subcutaneous, only the fat. In that scenario, if we are not properly maintaining our lifestyle, definitely it has a chances of once again the fat will be accumulated. It has a chances of recurrence. In part of sleeve gastrectomy, when the 1/3 of the stomach will be ligated with the staples and everything, in that the patient will start taking less amount of food. Even though 1 to 2 years, definitely he will not put on the weight. After that, if his intake has been increased, if he is not properly concentrating on physical activities and everything, they also have the things. The variable implantations, whatever we put through the endoscopy and these things, in that scenario also, if after removing the variable out of the stomach, once the patient will be very much back normal. Once again, after taking it out, once again, if he is going on taking uncontrolled, unconditional, if he is happy and is taking more amount of food, once again, they have a chances. All the procedures here, bariatric are also related. These are all maintenance surgery. They need to maintain that. They need to focus on their general condition. In that way, if they maintain, the results will be good. If they don't maintain it, once they have the problems of back to normal stage will be easily happens to that patients.
Yes, true, doctor. So in recent years, minimally invasive surgeries are becoming more common than open surgeries. So when is surgery considered minimally invasive, and what are the benefits and also the risks of minimally invasive laparoscopic surgeries, especially over the traditional open surgeries?
Yeah, minimal invasive is nothing but nowadays no one want to take a big scars on their body. Everyone want to have a small scar and best outcomes, immediate outcomes. If one small logic is, if we have a big scar, our recovery rate will be long. if we have a short scar, our recoveries will be little bit better. Nowadays, all the, see, wherever, and right now giving a big scar, putting our hands, and these are all big. Right now, small like instruments and equipments which have a 360 curve and everything has come into it. With the small holes, we can see into the TV and we can do crazy, big operations and everything. But one thing which we always say to our patients are, if they undergo on this minimal invasive is nothing but the word itself have a small source of entry into the body are called pinhole surgeries, keyhole surgeries, small hole surgeries. Comparatively from the big hole, if they do in a small way, that are. And what are all the minimal invasive techniques that are laparoscopy, lasers, and lasers, beam surgeries, and there are so many glues, adhesions, and these are all which are coming under minimal invasive. Definitely, the outcomes wise, minimal invasive procedures have a fastest recovery time comparative to the open, and the infections are also comparative less in minimal invasive, and the patient cosmetic look is also better in minimal invasive way. Rather than that, everything seems to be same.
So the recovery time is highly reduced through minimal invasive surgeries. Yes. So because during open surgeries, there is a big scar and the wound has to heal completely. But whereas
that's why.
Yeah, minimal invasive surgeries are always beneficial to the patients.
Few of the minimal invasive scars will be done with absorbable sutures, whereas there is no requirement for the patient to come back to the surgeon to take out their sutures. Whereas the big portions of open procedures and everything that required after 10 days, they need to come to the surgeon and come for the suture removal and all the things. And cosmetically also, look-wise also, the big incisions are not acceptable now. And right now, so many people in the world are turning themselves to the minimal invasive. And so many scars are been done such a way they don't, after the 1 month of the surgery, patient will not come to know whether he has undergone the surgery. Because we started doing so many of procedures in a very minimal invasive way, that too in unexpected places we are doing it. So that are all. So few of the thyroid surgeries, for suppose if the scars are given over their neck, then this will give them bad look to the pig. Then we are going with the rabbit procedure by the axilla with the robotic way we are doing it. There will be no scar over this. So for example, I'm saying this not to make everyone frightened about it. Thank you.
Okay, doctor. And also in modern medicine, lasers are increasingly utilized for the treatment of various kind of diseases. So how effective are these laser surgeries in comparison to other advanced type of surgeries?
Lasers are one of the good latest advances which have brought a very good differences in outcomes. Lasers have been, majorly the lasers are being used in piles, fissures, fistulas, pilonidal sinuses, and also varicose veins. And some lasers are for the cosmetic reasons and all the things. And this, a benefit of the laser is it's not a big hole. It is a very dotted pinhole surgeries. Will be just pushing from the skin into the, initially, previously, for example, if a person has undergone hemorrhoidal surgery, that is pile surgery, he would have got a cut, and after the surgery, he would have gone for 10 days of leave or rest, whatnot. These are all the common things. But these lasers have completely changed the game. Actually, we will be buzzing the hemorrhoids with the help of laser, and we'll be doing small procedure inside. Immediately after the surgery, after 1 day, patient can go back to his work. He will have a more comfortable zone. And simultaneously, the outcomes are very much far better than traditional methods. And even in the varicose veins, if we have a dilatation veins over the leg, if we pass, initially they used to be stripping ligation, they used to peel it off. But right now, these lasers are entering into the bloodstream, bursting out, coming out. Even after the surgery, patient will not have any big scar also. After 1 to 2 days, patient can go on walking. Even in the pilonidal surgery is most complicated, whereas the open way is to cut everything. These lasers are very much better in making things better to the patient, and outcomes are also comparatively good. And we are doing advanced lasers, and the outcomes which are being seen are really good, actually.
So are there any side effects of these laser surgeries?
Not at all, not at all. And yeah, if one thing I just want to say, when a laser is being placed, there is no spread of the laser to surrounding tissues. It is only 0.1 mm to 0.2 mm. 0.2 mm is 1/10 of 0.1 is nothing but 1/10 of the centimeter. There is no way that is going and falling on anything. It will directly go, touch the target, and it will come back. That's the only thing which will be done by the laser. There are no side effects. There are nothing with the lasers, but it should be done with the expertise hand. It should not be randomly placed here and there. Our eyes should be careful and everything. If we are randomly and if we are not handling it properly, then it is a problem. But if we are using it in a proper way, absolutely, there are no side effects and there are no problems which are mentioned even in the books, and even we doing so many number of patients, and everyone seems to be fine after the laser surgeries. Yes.
Okay, doctor. So, and also most of the cases, what happens is these patients, when they get discharged, post-surgery, they notice that they are losing a lot of weight and they start complaining that I have lost weight because of the surgery and all that. So what do you suggest these patients? What are your advices for them? So you're on mute, doctor.
Oh, sorry. If a patient feels that, after the surgery, he feels he would be, definitely I will put on the weight. If he is in the mindset, definitely it is going to happen. Once the patient, after the surgery, if he is taking proper nutrition, nourishment, and his protein things are being properly maintained, and his mindset and his counseling things and everything, if everything goes in the plane, there is no such type of it. But there is a taboo in everyone's mind that, if the surgery happens, weight loss will happen, this will happen, and that will happen. Nowadays, in the modernized world, these are all reduced and patients are doing fine, and they are not usually, comparatively, they are, this type of things have been reduced right now.
So you say that this loss of weight among patients is just their psychological state of mind, or because they are
psychological,
or because they are not having proper
maximum
food.
Of things. Because they feel like they don't take enough food. What they used to take prior to the surgery, they are not taking such in that amount of food. They will be reducing on it. They will be, you listen, if we eat that, it is going to infection, it cause infection. These are all the things which the patients have kept themselves in the brain, and there the problems are highlighting more. And definitely, it is not mandatory that if a patient is undergone surgery, he will put off the weight. It's nowhere just like that, and everything seems to be absolutely extra. Yeah.
Like you already mentioned, doctor, nutrition plays a very important role during post recovery period.
Yeah.
So after any kind of surgeries. So what kind of dietary instructions do you give to your patients?
There is no personal. Our homemade food is the.
Okay. So doctor, we actually lost you. Okay.
I think we are unable to reach to Dr. Balaganeshvedati. There must be some technical glitch, I believe.
Okay. So Ashish, can you please call him and just once try? Okay. Yeah.
Dr. Jamuna, I do believe what Dr. Bala was trying to say about surgery was quite interesting. And I have few questions that I am running in my mind regarding the myths that people are having regarding surgeries. And I hope Dr. Bala joins soon, because there are a lot, and I hope our audience is also having a lot in their mind. So please carry on.
Yeah. So what I feel is the doctor was trying to say that homemade food is the best food post-surgery. So usually what Dr. Balaganesh advises to his patients is have proper nutritious food even post-surgery. There is no restrictions that he gives to his patients unless and until the patients have some kind of comorbid conditions. For example, if they have already high blood sugar levels or high blood pressure, he might just advise them on reducing the sugar intake, on reducing the salt intake and other things. But if it is a normal patient who has come for a regular kind of laparoscopic surgeries or minimal invasive surgeries, for such kind of patients, he always advises that please go with homemade food with proper, proper nutrition. So this is the regular advice that he has been giving to all his patients. And also,
he's back, I think so.
Yeah, sorry, I have some signal loss. I thought of being in a place, but due to my busy surgeries, I could not go back to my home. So sorry for this small.
No problem, doctor. No problem. We understand. So hence I was telling the audience that Dr. Balaganesh always advises to go with home cooked food and nutritious food. And there are no restrictions in the food unless and until the patient has any kind of comorbid conditions. Yeah.
That's true. Absolutely true. And that's what patients should feel. And our QurHealth is also going accordingly. We don't give anything beyond the home thing. All the nutritions and everything are mixed up. And if the patients follow us, definitely, our journey with us will definitely make them to have home touch always throughout their time. Yeah.
Yes, doctor, like already you had mentioned that QurHealth is providing with the best services to your patients with this post-operative care. So post the surgery, we get your patient details and our care coordinators follow up with them. We arrange for a diet consultation. We are also arranged with a fitness coach consultation who will be advising them.
Yeah, definitely. Diet coaches and everyone, our patient coordinators are key for the QurHealth, and diet counselors are second most important people. Definitely, these people are going to be changers in patient outcomes. As per my previous experiences with you all, initial days, we used to blindly say the patients to do this, that, this. Whenever they come for the review, they used to ask us. But after associating with these people, they call the patient, they explain the importance of the nutrition, they explain, they spend time, they listen to their problems, they start giving their food, which usually they take in the normal due course of time. In this way, the patient's outcomes are also definitely increased by the counselors, diet counselors, even all the patient coordinators and all the things, which and really made a big difference.
And also psychotherapy counselors who come into picture when the patient is highly stressed.
And as if surgeons, we are not worried about all the prospective. Everything has been covered by you people. After the things, we will be just directly guiding to QurHealth, and this are giving counselors and everything. And we are surprised and happy also. They are there to take care. And one of the best part is they are giving us complete information of the patient. It's just not like we are ignoring it. We are getting all the basic required information from QurHealth about the patient, and we have a proper monitoring system. We know what patient is taking. We know what patient's outcomes are. We know how patients are doing in their routine lifestyle. The 3 points are very much important, and these are being covered. Yeah.
And our care coordinators make sure that none of your patients miss the medications.
100%. That is one of the important part. Yes, that is really an important part.
Yeah. Thank you very much, doctor. We have some of the questions from audience also. So Dr. Isha will be coordinating.
Sure. Make sure it is little bit less to them.
Yes, sure, doctor.
Sure, Dr. Bala, I know, you have taken a lot of time out for us. So there are a few myths that I'm having. Actually, the questions are more of, the myths that the people are, having in their minds regarding surgery. So many of them, one of the question is, surgery should always be the last resort for any of the problem. How true do you feel on this? But people try to delay the surgeries as well as possible.
It's not like that. It's not true in all the surgeries, only in the limited. But I want to say the early diagnosis is early cure. If we have a small problem, if we get operated in the initial days, we don't have a problem, we don't have a pain, and we don't have such type of prolonged thing. If we have something and we know it is only done by the surgery, at the time we should not delay in the time. It should be addressed in the surgical way only. We should not go jump in other treatment, complicate things and come back and go for the surgery. If jumping things are more, the surgery time, the surgery type of surgeries are changed. And definitely if something which is related with the surgery, it should not be questioned, it should not be delayed. That's my question to answer.
Correct. And just second last question from our end. One of the audience says, once you have taken anesthesia, you are never the same. And how dangerous is taking anesthesia? So that is the major myth, I believe, once it comes for surgeries.
And one thing in the modernized present day, anesthesia is a major branch, and there is no negligence and there is nothing. There are alternatives for the anesthesia with the anesthetist. They know if one anesthesia is not working on it, they know the alternative which should be done. And definitely it is not at all a game, problematic to the patient. And PAC, pre-anesthetist checkup, is done to each and every patient. They'll take the history, everything. And prior going to the surgery, they do the test dose also, whether these injections are also acting on it and everything. And previously there used to be, when I am in the childhood, I used to I know about some complications happened due to the anesthesia. Since last 10 to 12 years of the time, I didn't see any of it, and everything has upgraded their knowledges, updated their skills, and updated outcomes, and everything is personally good right now.
Thanks, doctor. And my last question is, that is from a female audience. They say, if females undergo any abdominal surgery, there are chances they may never get pregnant.
No, not at all. What type of abdominal surgeries is very much dependent. If they go with the hysterectomy is completely removing of uterus. If such so, there is no chances of pregnancy. Rather than this hysterectomy, if they undergo to any of the other surgeries like gastrectomy and any of the intestinal surgeries and everything, 100% they have, they can be pregnant and they have everything normal. The surgery will be only done to that particular part. Until if we don't remove the uterus, there is no problem for anyone to go for this step. If they have a ovarian PCOD, severe PCODs, they have chances, but rather if we are not touching on a uterus and ovaries, they have a chances of being pregnant also. There is no such type of surgeries are not related with any of these problems. Yeah.
Sure, Dr. Bala. So I will put an end to all my questions, but I do believe there is one major, question among audience, that they don't talk to their surgeons. And if they do talk, I think so many of these myths will be answered. And if the surgeon is you, I think so they'll be in a very, great care. So thanks a lot for your time. And thanks, Dr. Jamuna. Over to you.
Yeah. Thank you.
Yeah. Thank you very much, Dr. Bala Ganesh, and also thank you, Isha, for coordinating. And Dr. Bala, you explained so well in detail about all the surgical complications and what kind of care has to be taken, and what are the positive outcomes of post-operative care. Yeah. I'm sure that today's audience would have got enough knowledge related to post-operative care, and they will surely follow the instructions that you have given, and as per your advice, they will try to prevent all kind of complications. So, sure. Dear viewers, to avail the benefits of our care plans and diet plans along with our care coordination services, please download QurBook app from Play Store. We have introduced various kinds of post-surgical care plans and diet plans in QurBook app, especially for patients who have underwent surgeries for various disease conditions.
And depending on your outcomes, I voluntarily turned as your brand ambassador. I'm trying every patient to go with the QurHealth, and I request all the patients who are from Hyderabad in and around, contact us. You will be in a definitely good hands, even from the surgeon, even after the post-operative care, which is given by QurHealth, is amazing. And it's not at all any marketing thing. What I personally feel, I'm trying to say that to you all. That's the point which I want to explain. Now, I think I need to go to the OT now.
Yes,
everyone are questioning it. Yeah, sure. I'll just call you back. Thank you all, and for giving a wonderful opportunity to talk to you all. Due to my rush, I'm not able to stay for the last minute. Thank you so much for all of you as a personal part. Thank you.
Thank you all for joining today's session. Thank you. Take care. Bye.